If there's one decision that you will make that will change the course of your professional careers, it's doing a residency. Welcome to ASCO's Residency webinar series, everything you want to know about residencies. Today's discussion will be on why do a residency. I'm Dr. Diana Damchick, Director of Residency Education at SUNY College of Optometry. Our general discussion today will ask a number of questions that will hopefully also provide you some answers to these questions that will be so important to determining whether you will pursue a residency. Why do a residency? What type of residency should I do? Where should I do a residency? What is an accredited residency? And where do I get information? So the most important question that we're going to ask is why do a residency? The flip side of the coin, I'm going to ask the question, why not do a residency? A residency provides the avenue to advanced clinical competencies. Each and every one of you have an outstanding education at your respective schools and colleges of optometry. They provide you with core competencies. A residency takes you to the next level. And this is an important part of the discussion that we will have because it takes you to a different level than just what you'll receive at the basic level of the professional program. So, some questions and considerations that will help you as you think along the way. Why do a residency? Well, the first thing I ask, because a lot of people think that those who follow or pursue residency education have a specific career goal in mind. My question to you is, do you anticipate seeing patients? If the answer is yes, which I believe will be for everyone, then residencies are an important consideration for you because residencies will provide you an advanced clinical competency and an advanced clinical way of critically thinking so that each and every patient that you see, you'll look at with a different, renewed, and very important criticality of being able to provide them with an even higher level of care than you might have if you did not do a residency. What are your career goals? Clearly, for some of the career paths, residency as a credential is very important. What are the opportunities that may be open to you by doing a residency? There may be opportunities that at this stage you may not even be aware of that will be open to you as a result of your residency training. Will you teach? Is that something in your career path? Clearly, clinical teaching is looking for those who have the training that residency education provides, an important credential. What type of setting do you plan on working in? Other settings that really require residency education include hospital-based settings, Veterans Administration settings. A wide variety are now looking for people who are trained in residency education. So that setting would be an important one for you to consider that credential. And if you pursue private practice, again, going back to when you see patients, you will bring a certain skill set to those patients, irrespective of the practice setting that you're in. What are your current obligations that you have? Would these obligations preclude or allow you to easily follow into a residency program? The way that I would look at it or suggest you to look at it is you will hopefully be doing optometry for possibly 40 plus years. 1 year out of those 40 plus years to dedicate to an additional year of clinical training can change the rest of your professional career. So even though you may have a variety of obligations, look at it that one more added year can have an impact that you might not even begin to be able to understand or fathom at this point in time. And when is the best time? Well, now is the best time. Typically, the best time is after you finish your professional program. There are some that may say, I'll come back and I'll do a residency after going out and working for a couple of years. And indeed, there will be some that will do that. But I will tell you that the vast majority of people do not come back after they've been out for a number of years to do a residency. Doesn't mean that there are some that don't. There's some that actually do come back, but that's unusual. Most people do residencies after they finish their professional degree program. So now's the time to really think about it, because you're in that frame of mind, you're in that mindset of being part of an academic type of a setting and continuing to learn at the highest degree possible. So now is the best time. What are some of the pros and cons of doing a residency? Well, when we look at the pros, you've heard me talk many times about achieving advanced competencies and advanced clinical thinking skills. This is so important to the care that you bring to the patients that you will see. Specialty training is a result of doing residencies. It is a credential for a variety of settings, including teaching, academic settings, hospital VA settings, and tertiary care centers. It develops lifelong skills. It also allows you to explore aspects that you might not normally be exposed to. What I suggest when people do residencies is to allow yourself to do things that you might not normally be doing. It will allow you opportunities to explore things that you might not normally think that you would enjoy or like doing. So think out of the box. Maybe doing public speaking is something you end up enjoying, or writing a publishable quality paper, or pursuing evidence-based type of medicine and looking at the literature in a unique way that maybe you're not doing right now. So there are a variety of different aspects that you might explore as part of your residency while you're thinking out of the box and maybe a little bit out of your comfort zone that will help you to grow, that will last you the rest of your life. Potential future opportunities that will be open to you. And an added year of experience is also a pro of residencies. And I will say that that added year is unparalleled, even to years of work experience that one may get if they don't do a residency. What are some of the cons in regards to residencies? Salary is probably one of the largest cons. In addition, if there's financial obligations that one has because of the low salary, that can be a con to a residency. Somebody may have a job offer that seems to be the ideal job for them, and they're concerned about delaying taking hold of that job opportunity by doing a one-year residency program. Wanting to get out to work is one of the other reasons that might be a con to doing a residency program, and family and personal obligations. I would say, though, for each of these cons, there are ways and perspectives to look at it that can be overcome, that residency education can still be worked out and fit in, even with these various cons that might be present against against having the opportunity of doing residencies. What are the various types of residencies that are out there? In 2021, ASCO, the Association of Schools and Colleges of Optometry, relooked at the titles of residency programs. And what resulted from this reassessment is what's known as the category for a residency program. The category is the majority of the program's clinical and didactic curriculum. It includes one of these various areas. The residency is either a primary care optometry residency, pediatric residency, cornea and contact lens, vision rehab, or ocular disease. In addition, ASCO also provided the opportunity for a program to designate various types of emphasis areas, up to 2 areas for each of the programs. The emphasis area includes 30 or more % of the clinical and didactic curriculum of the program itself. Now, the emphasis areas could be it can be in any of the categories that are also general category titles. So the emphasis area can be in primary care, pediatrics, cornea, vision rehab, or ocular disease. So, for instance, you can have a program whose category is primary care, but has an emphasis area in ocular disease. Or you can have a program that has, for instance, an ocular disease category with an emphasis in primary care. In addition to those 5 areas that overlap between category and emphasis, there are a number of other potential emphasis areas. These include family practice optometry, community health optometry, geriatrics optometry, refractive and ocular surgery, anterior segment, glaucoma, retina, neurooptometry, vision therapy and vision rehabilitation, low vision rehabilitation, and brain injury. So, for instance, you can have a residency program that is a vision rehabilitation program, but it has an emphasis in low vision rehabilitation as an example of the various types of combination that you can get. Where should you do a residency? Now you've decided that you would like to pursue residency education, and where can you and where should you consider looking? So the locations of the residency programs are varied. They can be school-based, they can be at a medical school, they can be hospital-based, they can be at a Veterans Administration hospital, they can be at other types of federally based types of settings, such as the Indian Health Reservation. They can be located in private practices. They could be located at community health centers or clinics. They can be located at tertiary care centers. So there's a wide variety of locations that the residency itself can take place. In addition, location considerations include geographic and regional considerations throughout the country. What does the role of accreditation play when you're looking at residency programs? The Accreditation Council on Optometric Education has a mission, and its mission is to serve the public and the profession of optometry by establishing and maintaining and applying standards to ensure the academic quality and continuous improvement of optometric education. It does this in professional programs and specifically residency education or residency programs that we are discussing. The Accreditation Council on Optometric Education isn't just a group of people that got together and said, we'll set up some standards for the professional schools and for optometric residency programs. They actually have to answer to a higher power, and that is they are recognized and must demonstrate compliance to criteria established by the United States Department of Education and the Council on Higher Education Accreditation. Now, what is accreditation? What are their standards look at in regards to residency programs? There are 6 standards that they look at: the mission, goals, and objectives of the program, the curriculum, the administration, the faculty, the residents, and resources and facilities. Let me bring out a couple of important points of each of these standards to help you to understand what each residency program must be able to meet in order to become accredited. The mission, goals, and objectives talk about the purpose of the program. The curriculum, and I highlight this in red because this is so critical to each residency program. And what does Standard 2.4 say? The intent is to ensure that the residency provides clinical, didactic, and scholarly activities that will develop advanced clinical competence, effective communication skills, and lifelong learning skills. This is what you will achieve by doing a residency that will reflect the accreditation standards. In addition, a couple other points I want to bring out to you. For the administration, it looks at the role of the program supervisor and the role of the school or college of optometry. Now, some residency programs are located at a school or college of optometry, but many are located outside a school or college of optometry. They need to be affiliated with a school or college of optometry. And that's very important because the role of the school or college of optometry is to help to guide the program and assure that the program is meeting the educational component that it's supposed to be meeting. The resident standard, it looks at specific policies for the residencies in order to help to protect and ensure that certain aspects of the residency program for the resident is met and achieved. Another thing that I want to bring up that's of an important consideration are new programs. New programs don't start off being accredited. The reason for that is because it's new and it hasn't gathered enough information yet to be able to provide to ACOE the evidence that it's meeting the standards. That doesn't mean you shouldn't be looking at new programs. Actually, what you should be doing and asking the question, if there's a newly established program, is their intention to pursue accreditation within the first year of the program's inception. If the program achieves and has the site visit and achieves accreditation within its first year of the inception of the program, that residency will be considered accredited. You just have to understand that in order to meet the standards, that evidence has to be acquired over time during the course of the residency. So often the site visit for that program is in the latter part of the year. And again, look at the program. If it's a new program, just check to make sure that there's every intention from the program supervisor and the affiliate that they will be pursuing accreditation within that first year. So where do you get information in regards to residency programs? There's a number of areas that you should consider and look into in regards to gathering information. Talk to the residents, talk to the current residents, talk to former residents of the program. Talk to the residency program supervisor. Talk to the residency directors to get information about the programs. Networking opportunities provide you a wonderful opportunity to talk to multiple supervisors, directors, and even possibly the residents themselves, such as the academy meeting. Webinars like this provide you with a lot of information that will help you think through and sort through what you want to do and how you want to pursue it. And then the website offers a wide variety of information. Begin with the website that ASCO has, where it will tell you, where it can link you to the various types of residency programs and provide you information. The optometry residency matching service also provides a lot of information in regards to residency programs, residency education, and ORMatch, obviously, the application process. And go to the individual schools and colleges of optometry. They have their own pages in regards to the residency programs that are at or affiliated with each of the schools and colleges of optometry. So now let me leave you with two pieces of advice, if I may. One of the most important things is to follow your dream. Optometry is a wonderful profession, and it will bring you many, many years of satisfaction and good works. In order to fulfill and follow that dream, residency education may help to achieve and pave the way to you obtaining the dream that you have set before you. And my second piece of advice is how we began. If there's one decision that you make that will change the course of your professional career, it's doing a residency. I wish you the very best in what you pursue and how you pursue things in your professional career. I wish you the very best in regards to your consideration in residency education and understanding the importance that it may play in allowing you to achieve your dream. All the best. Thank you for your attention.